Officials inside the State Department say they are disturbed at the way Secretary of State Mike Pompeo and other senior administration officials have handled the building's response to the coronavirus pandemic.
Over the last 2 weeks, officials inside the department's headquarters in Washington and in at least 2 embassies overseas have voiced their frustrations to superiors about the absence of information on how the department planned to prevent community spread, the scant guidance on how to handle travel and meetings with foreign officials from hotspot regions, and the lack of transparency on internal coronavirus case numbers.
That's according to 5 State Department officials, all of whom spoke to the Daily Beast over the last week on the condition of anonymity because they fear retribution from the Secretary's office. The State Department did not immediately respond to a request for comment, but Pompeo was set to brief reporters Tuesday afternoon.
When the cases started to jump in the U.S., there was almost zero communication on whether we should continue on with our work like normal or whether we should curtail interactions with people from countries in Asia and Europe where the virus was already killing hundreds of people, one official said. We knew there were conversations ongoing in the Secretary's office, but there was no transparency about how they were handling all of it.
The increasing frustration among officials at state comes as the Trump administration tries to play catch-up with the rest of the world, to not only contain the virus but to treat COVID-19 patients with limited amounts of key medical supplies and equipment. The internal calls for more clarity from Pompeo's office underscore the degree to which the department has struggled to maintain a foothold on the evolving crisis and to restore calm among its own people. 2 officials who spoke to the Daily Beast did say that communication from the Secretary's office had improved over the last several days.
Pompeo and his team need to be transparent and forthcoming with their employees who are smack in the middle of an unprecedented global crisis, a congressional aide told the Daily Beast. But the component functions under the Secretary are doing their level best and have our support.
The department attempted to answer questions from its employees last week in a series of conference calls. But officials who spoke to the Daily Beast said it was too little too late, some pointing to the chaos that ensued following the president's Oval Office speech in which he announced European travel restrictions. 2 officials based overseas said they were not given a heads-up about the plan to limit travel and spent the next day fielding calls from their international counterparts asking for clarification on the White House's announcement. One official said they did not receive guidance on how to handle visa requests and other consular duties until the morning of March 13, almost 2 days after the president's address.
Back in Washington, as state governments began to close schools and asked the public to work from home, officials in the department sought answers on whether they, too, should decrease their time in the building. Some overseas posts had already issued guidance internally within their offices about teleworking, but officials in Washington working out of the headquarters building were not told to go home. Instead, senior officials told their teams that they could work from home if they felt they needed to. The conflicting guidance caused internal confusion and resentment among officials who said they had to learn from their colleagues about how each office was handling the situation. There was no clear message from Pompeo himself, the officials said.
There's been a severe lack of information on what we should be handling ourselves amid this crisis, one official said, adding that no one had put out hand sanitizing bottles in the building. People could be coming in sick and they might not even know it.
Over the last week, rumors swirled that there were a number of individuals in the building and overseas who had tested positive for the virus, but the Secretary's office had failed to communicate that data point, one official said. The lack of communication caused officials to panic, wondering if they had come into contact with those individuals.
Throughout the last 2 weeks, officials inside the department building in Washington have continued to hold meetings with foreign individuals, some from Asian and European countries, in rooms that do not allow for proper social distancing, one official told the Daily Beast. In a press conference Tuesday, Pompeo said that a handful of department employees had tested positive for coronavirus but did not specify how many or where they were located across the globe. When asked how his office was handling the outbreak, Pompeo said he had limited travel and issued 15 new guidelines. It was unclear if the secretary was referring to the same guidelines the White House Coronavirus Task Force announced Monday in a briefing with reporters. The work our medical team has done, the work we did to get Americans out of Wuhan is in the finest tradition of American diplomacy, Pompeo said. We have an obligation to take care of all of our team and we will continue to do that.
The calls for increased transparency and action reached Capitol Hill in the last few days, where lawmakers are calling on the department for briefings on how Pompeo is handling the coronavirus response. Senior officials from the State Department briefed House staffers Tuesday morning. Officials told staffers that the department had made strides in the last several days to draft clear policies and to boost communication from Washington to foreign posts, one Democratic aide told the Daily Beast. Another aide said State told staffers that it is focusing its efforts on ensuring that employees based overseas who are sick can receive a coronavirus test. The department is relying on host governments when they can, but is also in the process of trying to partner with a commercial vendor to use at posts.
Senator Bob Menendez, DNJ, on Monday sent a letter to Pompeo asking for the secretary to immediately rectify the State Department's slow and deficient response to the coronavirus pandemic. I fear the department's lack of a robust response has put the health of its own employees, including those stationed abroad, at further risk, and further jeopardize the health and well-being of the American people, Menendez wrote.
Menendez called for the department to clarify its contingency plans and asked for copies of its response plan for any suspected or confirmed cases.
His second tour in Afghanistan over, Henry Chinesky stepped off a plane on Sunday not into the waiting arms of his family, but the U.S. Army. Along with 3 other soldiers in a 15 by 15-foot room he likens to a prison cell, Chinesky has spent the past 3 days in quarantine as a precautionary measure against the coronavirus.
Except Chinesky and his fellow soldiers aren't tested for COVID-19. Medics come by once a day, take their temperatures, and move on. Until Tuesday, they weren't even allowed to leave their room at Fort Bliss, not to exercise or even just enjoy a gulp of fresh El Paso air after the crucible of Afghanistan. They get 2 meals a day, 2 bottles of water, 1 bathroom between them and no further information about what they're supposed to do during their 14-day stay in quarantine.
This is the most dysfunctional army operation I've ever seen in nearly 17 years of service, Chinesky tells the Daily Beast via text. Henry Chinesky, as fans of Charles Bukowski will have spotted, is a pseudonym. The Daily Beast has independently verified his identity.
Chinesky is part of the first wave of troops put into quarantine after returning from Afghanistan and other elevated risk locations, a decision meant to stymie the coronavirus outbreak in the United States. Military quarantines, said to be motivated by an abundance of caution, are also taking place at Fort Bragg, Fort Gordon, and even undisclosed locations. Chinesky's experience is among the first outsiders have gotten into the realities of military life under quarantine.
Prisoners receive better care and conditions than that which we are experiencing at Fort Bliss, said Chinesky. The Army was not prepared, nor equipped to deal with this quarantine instruction and it has been implemented very poorly.
According to Chinesky, he's one of 169 soldiers and Defense Department civilian employees quarantined at Bliss. They're active duty soldiers and reservists deployed to various Mideast combat zones for tours of 6 months to a year. Neither he nor anyone on his flight home displayed coronavirus symptoms, though the world is learning that is no guarantee.
The Army served them quarantine breakfasts of canned tuna and tortillas. A picture Chinesky sent to the Daily Beast of a styrofoam container with his rations showed a scoop of scrambled eggs, potatoes, and 2 halves of a sausage.
About the only thing occupying Chinesky's time is his phone. He's been able to notify his family that he's okay and stuck on Bliss. Since officers on the base aren't permitting the quarantined soldiers access to material from the Morale Welfare and Recreation Services, movies, paperbacks, games and other entertainment to pass Army downtime, he's playing chess on his phone between watching Hulu and Netflix and listening to audiobooks. In his queue, Tolkien, William Gibson, and Steve Call's 2 Afghanistan books, Ghost Wars and Directorate S.
Outside of that, Chinesky has little else to do besides attempt some in-room lunges, push-ups and sit-ups. On Tuesday, he texted, "They got 20 minutes of yard time." Their senses of humor are keeping them going, but the frustrations are mounting as the quarantine drags on.
The Army was not prepared, nor equipped, to deal with this quarantine instruction and it has been implemented very poorly, he said.
Contacted by the Daily Beast, Army officials at Fort Bliss said, "The health and safety of our service members is our top priority. We're aware of concerns regarding quarantine conditions. We take these concerns seriously and are looking into them. The quarantine site is new for all service members who are redeploying from overseas and we continue to build capacity at each site on Fort Bliss."
When asked about efforts to remedy the conditions described by Chinesky, no reply was returned to the Daily Beast. Chinesky said on Monday that he has not seen any indications that Army officials at Fort Bliss are working to improve conditions while soldiers are in quarantine.
"They are just running up and down the hallways, yelling at us like we are basic trainees," said Chinesky. "It took over 12 hours for one soldier to get medical treatment for a back spasm."
He added, "They are only concerned with the coronavirus and nothing else. There is no sustainment plan. No medical plan. Senior leaders are nowhere to be seen or to answer questions. We have colonels and chief warrant officers, down to privates in quarantine and there is no respect from the cadre from 1st Armored Division." As
Americans come to terms with severe disruptions to everyday life amid conflicting signals from the Trump administration about the coronavirus, the Army has been scrambling to address the crisis in the face of a financial shortfall.
Last week, the Daily Beast reported that the service's response to the coronavirus outbreak was short on funding by almost $1 billion, according to a document provided by a Defense Department official.
The document, marked in classified but for official use only, was a part of a brief given to senior Army leaders last Thursday by the Assistant Secretary of the Army for Financial Management and Controller, the Army's primary office for fiscal matters.
The Defense Department said Monday that the agency has limited capabilities to aid the public health care system as coronavirus threatens to overwhelm it.
"What we are trying to be very careful about is not overpromising," Joint Staff Surgeon General Brigadier General Paul Friedrichs said at the Pentagon Monday. "We want to be factual about what we have. Our fixed facilities are designed to the force that we have. They are not 1,000-bed medical centers all over the United States. They are, for the most part, small community hospitals."
Friedrichs said the Defense Department can build hospital tents and move people to naval ships. But neither of those options are designed for treating infectious diseases, as they focus on treating trauma patients.
"The challenge is if we build a 200-bed or a 25-bed trauma hospital to take care of people with coronavirus, that's not really a great solution to the coronavirus challenge," said Friedrichs. "We don't have any 500-bed hospitals designed for infectious disease outbreaks. That does not exist in the inventory."
Another document obtained by the Daily Beast shows Army quarantine options around the United States, Italy and South Korea. The document was also a part of the brief given to Army officials last week.
Between the Defense Department and state-owned Army National Guard units, military planners identified 12,239 rooms on military land with individual bathrooms that can be shared between males and females. The rooms are also located within 1 hour of a civilian medical facility, according to the document.
On Tuesday, Defense Secretary Mark Esper visited the U.S. Army's top biological defense laboratory at Fort Detrick, but confirmed the U.S. Army Medical Research Institute for Infectious Diseases is still 12 to 18 months away from any COVID-19 vaccine. As
an immediate response to the spread of the virus, Esper told reporters he was releasing from military stocks up to 5 million N95 respirator masks for the Department of Health and Human Services to distribute, as well as 2,000 deployable ventilators. Some 1,500 National Guardsmen are active across 18 states, he said, but decisions on federalizing them carry the trade-off of pulling medical personnel out of their civilian functions.
"I recognize our decisions impact service members and their families, and I want them to know we are all in this together," Esper said.
Inside his cramped room at Fort Bliss, Chinesky has a different takeaway.
"This is no way to treat soldiers returning from war," he said, "and it has undoubtedly changed my view of remaining in the U.S. military following this deployment."
With additional reporting by Adam Ronsley.